Welcome to the Macro Habits Podcast. I'm your host, Hannah. Today we are joined by a guest that I am so excited about, you guys. I have Molly Tomich next to me. Did I say your last name right?
Yes, Tomich.
Okay, Tomich. And she is my injector, my beloved injector.
Love you.
I have so many good questions that I have personally thought of. And then I also did Q&A on my Instagram, and you guys gave me all of your questions as well. So we're going to go through a lot of good questions in today's episode about injections, Botox, aesthetics, treatments, lasers, all the things.
Everything.
One thing I love about you is you're an open book.
Yes.
And you're a wealth of knowledge.
Thank
so
you.
I can't wait to pick your brain.
I'm so excited.
Before we get into this, though, you are such a well-credentialed person.
Aww.
I want to give a little brief kind of synopsis of who you are, a little nugget just to the audience so they have a feel. So Molly is a board-certified physician assistant. She has an extensive background in medical dermatology, which has served as an amazing foundation to her aesthetic career. She has been in aesthetics in some capacity for 9 years. Her approach is always natural and understated with an emphasis on balance, harmony, and skin quality. She combines her love for skincare and dermatology with aesthetics and loves creating comprehensive treatment plans for her patients. She practices at Skin Spirit, which is literally right across the street in Newport Beach. And she is married with 2 perfect little boys. So you are a busy lady.
What a nice intro, Hannah.
No, of course. I just think so highly of you. And just in your field, I'm 30 now, and like I started getting Botox early 20s.
Yeah.
And I've been to quite a few injectors.
Totally.
And when I met you, there were so many things that stood out to me, but one thing that I loved is how honest you were.
Yes.
I mean, you've told me no a million times.
100%. I always say, like, if you are trying to build a lifelong client, you have to tell your patient no when like something isn't the right fit for them, because if I am just trying to sell a syringe or sell a service, that person is going to find somewhere else to go and not build that long-term relationship. So truth, honesty, transparency, and education are like what I always lead with.
Yeah, and it's very apparent. And it's one of the first things that I noticed. I also love too, in our first appointment, I wanted to get something done.
Yes.
And you gave me everything that could go wrong.
Oh, yeah.
Which I really appreciated.
Yeah.
Because I think a lot of the time things are kind of swept under the rug. Like,
Totally.
this is what it's going to happen and this is what it's going to do. But there are side effects to everything.
For sure.
I mean,
well, and I think that people forget, like, in a lot of ways, aesthetics is kind of like lumped into the beauty industry. Like, we're lumped into like your lash girl, your brow girl. But like, I always remind people, like, this is aesthetic medicine. Like, I went to PA school. I went to school for 6 years for this. Like, I studied super hard. And like, I always lead with like the medical side, because I'm like, this is a medical procedure. There are ramifications and there are things that can go wrong. So like, obviously we hope they don't, but like I always like to give people like all of the education so they know that and they're informed about the procedure they're getting done.
which is, as a patient, like that resonated with me so much, and it made me feel safe. And I remember when I got Sculptra, you told me, you were like, "Okay, after I do this, you're gonna look a little Maleficent-esque."
Yes.
You know?
And
I
you
was
did.
like, sure enough, I was like, okay. And it's obviously just the swelling and like the blood flow or whatever, however you explained it.
Totally.
But I didn't have a freak out because
Yeah.
I knew exactly what was going to happen.
Totally. Well, and after so many years in this industry, I can kind of foresee what questions, what side effects, like what the most common concerns are that patients are going to have. And I can kind of like prepare them for those so that hopefully I am able to, you know, equip my patients with all the knowledge so that when their lips are swollen and they have buyer's remorse, they're not like, oh my God, what did I do? I want to dissolve them. They know, okay, Molly told me this would happen, and they trust the process.
Yeah, no, that's amazing. So if you're in the Newport Beach area, I mean, I know everyone after listening to this is going to be running to Skin Spirit.
Stop.
But before we get into the bulk of today's episode, I always do a high and a low to kick off my podcast episodes. So let's start with your high.
Okay.
I want to hear it because you told me. Give me a little
My
nugget.
high
I want to hear.
was so high. Okay. Over the weekend, I was invited to a pre-Oscars party with Skin Better. L'Oreal was like one of the sponsors, and I got to meet like some of my celebrity crushes: Kate Hudson, Jacob Elordi, and Ali Larder, who I'm like obsessed with. And it was just such a fun moment. It was like a fangirl moment, and it was the best.
No, that's major. Kate Hudson would have me.
Oh, I couldn't even help myself. I was like, oh my God, Kate. And she like double took, like as if like, wait, do I know you? And I was like, I just am a really big fan, but I just pretended I was her best friend.
How was their aura in person?
Honestly, so magnetic. Like, you realize these stars are famous for a reason. Like, they walk into a room and they just like steal the, like, Kate Hudson was just glowing from like the inside, and like she doesn't even get that much work done. Like, she had like, you know, lines on her forehead, like you could tell she doesn't do Botox, but her aura, she's just like a glowing gal. And I was like, I'm obsessed with you. Allie Larder, so beautiful.
So beautiful.
I was like, you are goals at 50 years old.
Wow. And Jacob Elordi.
And Jacob Elordi is like,
how tall is he?
Oh, he's tall. He's like, I don't know. I think I even said, I was like, you're really tall in person. He's got to be at least 6'3".
Oh my gosh.
Yeah, he's tall.
Wait, that's so fun.
Yeah, it was so fun. So that was my high.
Yeah, no, that's a good high. That's my high is I'm going to Nashville on Friday.
Love this.
So I'm so excited.
Have you been before?
Once.
Okay.
I went
so
once
fun.
with my best friend Lexi like a year and a half ago.
Okay.
And it was so much fun.
It's
but
the best. And do you like country music?
Yes.
Okay. So you're going to have a blast.
Yes, love the vibe. Like, we have some good reservations. Like, I'm just so excited.
Yeah, the food scene there is amazing.
I know. So that's my high. My low, it's really not that deep, but, and I don't know if you're watching the show. I was actually going to ask you, but I wanted to ask you on the pod. Do you watch The Secret Lives of Mormon Wives?
I'm not watching this season. I need to. I'm still so behind on Summer House and Southern Charm that I've got my books full right now.
No, and that's how I feel. Like, I haven't dabbled with those because I'm Real Housewives of Salt Lake.
Yes.
Love is Blind and The Secret Lives of Mormon Wives.
Okay.
And my low is that I finished all three. So I'm now
You're like, okay, so
tonight,
now what?
No, I actually have like an
Summer
empty
House.
feeling. Okay, so I'll start Summer House.
Is so good.
I will. But The Secret Lives of Mormon Wives, I finished it last night, and like, wow, it was.
Was it so good?
So good.
I want to watch because Taylor Frankie Paul's The Bachelorette
I know.
too. Does that like overlap with the show at all?
Well, yeah, they actually show a little bit of her getting ready to go off to LA and kind of like a little bit of the process.
Okay.
But her on the show is not featured on the actual Mormon Wives show.
Right.
But it's just such a fun thing to watch. I mean, I know it's their real lives and there's like an enormous amount of drama, but it just to like a viewer like me, it's so entertaining.
Well, and like with your background, like knowing about like LDS, I'm sure it's even more interesting to just be like, whoa,
I know the
like,
lore.
Yes.
I understand it on like a different level. So that's my low is I'm now, now I have a show.
Yeah.
So that's a low
there you go,
into
Summer
a high.
House. My low is that my 4-month-old is going through a 4-month sleep regression, and he's getting up at like 1, 3, and 5, and your girl's a little bit tired. But that's what we have matcha for.
Yes.
So.
And Molly brought me matcha. Also, it's St. Patrick's Day.
I know.
Cheers.
Happy St. Patty's Day.
I know. I'm not really like, I like matcha, but the more I drink it, the more I like it.
Yeah. I love it. It's kind of an acquired taste. Like, and they do a really good job, but sometimes it is like a little grassy.
I kind of like that.
Yeah.
Part of it. I actually like when it's too sweet.
I like when it's earthy.
Yes.
Yeah.
Grounds me.
Yeah. Just grounded girlies over here.
You know it. Okay, well, I'm sorry about your little baby.
It's okay.
But your kids you guys, Molly has
You're so sweet.
the most perfect children. Like, I'm not even just saying that. I know there's Ford and then Dane.
Yes, Dane is the newest.
Well, your family in general is just, you and your husband are a beautiful couple.
I love you.
And then your offspring are even more beautiful. And I'm like, I look at you and I'm like, that is what I want.
You're so sweet.
That is what I want. So
I'm obviously partial, but I'm obsessed with them. And like their little brother bond is so cute. Like the way that Dane now just like looks up at Ford and is like, he's his hero. Like you can tell that Dane's just like, you're so cool. And I'm like, I can't wait to see that flourish.
That's
you know,
so cute.
It's really cute.
Do you want more kids?
No.
You're done. Yeah.
I'm done.
I want 2 as well.
Yeah, I'm 2 and done. We thought we wanted 3, but I'm like, I feel like as a working mom too, I like really want to be able to give my kids enough of me. And I feel like if I had a third, I'd be spread too thin. Like I just know that about myself.
Yeah.
So
no, I think that's how I kind of feel. I think when you work and you have your own
it's like
thing,
a third baby.
Yes. I mean, I have a podcast now and Macro Habits, like the coaching program. I have 2 babies already.
Literally.
So I'm like, okay, I can only have 4 kids, I think.
Yes, totally.
Okay, let's get into the episode.
Okay.
So like I kind of explained at the beginning, I have acquired all the good questions that my audience had for you, and then selfishly ones that I want to ask.
Okay.
So first thing is, when should someone get Botox?
Okay. I get this question a lot, and there's no like set age. Like I would say that it really is My rule of thumb is whenever you notice lines at rest. So if your makeup is starting to settle in lines, if you're just feeling like, ooh, that etched line was never there before, and you're just starting to see like the inkling of an 11 or a forehead line, that's a great time to start Botox, because essentially that line is never going to get more superficial. It's only going to get deeper and get more etched into the skin, and then you're going to have to do more invasive procedures to reverse it. So at the first sign of lines at rest is a good time to start.
Do you think there's a too young age or someone that's too young?
That's a good question too, because so I have seen this new trend of like really young, like 20-year-olds coming in to get Botox because like their friend did or their cousin did. And I would say if you don't have any inkling of any lines at rest, I would actually start with something like microneedling over Botox. Like, I don't think that everybody needs to start Botox, you know? And I do think that like there's something to be said for like maybe being too young to the point where like you could, it's not going to hurt anything, but it's also like, do you need that? And like, is your money better spent somewhere else? And like, I'm always trying to look out a little bit for like the patient's pocket where I'm like, what is going to be best suited for you, but also like the best bang for your buck? Like, if you have 0 lines at rest and you're getting Botox, you're not going to be very wowed by the results because like your forehead was smooth to begin with. But if you're starting to like maybe notice a little bit of like aging to the point where like maybe a good retinol at home would help with, or microneedling, then I'm all for that.
Okay, I love that. What's your take on baby Botox?
Okay, don't love
What is
baby
baby
Botox.
Botox?
Baby Botox was like basically people that wanted to start getting Botox, but not like the full recommended dose. So they were doing like little tiny micro doses. And essentially, baby Botox is great because people obviously get like a taste of what Botox is, but it does not last. The duration will literally last like 6 weeks at best. So I always tell people, I'm like, if you like your Botox result, like it's to your benefit to do the recommended dosing because you're just going to get more longevity and more duration out of it. So people always think like more units mean more frozen. That's not the case. Like more units just mean more duration. So baby Botox, it's like, okay, you're going to love your results for a month and then it's going to be gone.
Okay.
So not a big fan of it.
I always hear that term on like Instagram.
Yes, yeah.
Like, I'm getting baby Botox and I'm like, bitch, you're just getting Botox.
Botox. And I do think that a lot of influencers like saying that because they're like, oh, I don't get a lot. I'm like, there's not like a difference between like getting a lot or a little in terms of like
I know
systemic absorption. So
I feel like it's so situational.
Yes.
Because me and my friends, they'll be like, how many units did you get? And I'm like, oh, I got like 60. And they're like, oh, I got 80 or I got 40. And
everyone's
I'm like,
muscles are so different. I always say never compare your Botox doses in the same way that I would never be like, what dose of antibiotic did your doctor prescribe you? Like, I don't know.
Even
I'm
with
just
macro
taking,
splits.
Yes. Exactly.
Everyone should be a different macro split. So
You're
I feel
so
like
right.
in every field.
That's actually the perfect comparison. Like my macros are going to obviously be way different than yours.
Yes.
Yeah.
Yes. And I, just to go back to the point you made about when you start to see a visible line.
Yeah.
My mom, so bless her heart, I don't think she'll care that I'm sharing this, but when I first started dabbling in like Botox and like filler and stuff, I was in Northern California. This is like a long time ago. And the lady that I went to there, like I got recommended to her and I got like a little lip filler. I got Restylane, which my body absolutely hated. And it wasn't a good, not a good experience. But my mom, I was like, Mom, you need to get Botox. My mom has severe lines now because she never
did anything.
And she's so beautiful. And one thing I love about my mom,
she's stunning. I've seen her on your stories.
Yes. She is all about aging gracefully. And she really does that. Like she really doesn't do anything and she doesn't need it. Like she's so beautiful. And it's sweet because she always used to say like, I never got a, she'd be like, I never got a boob job because I didn't want to set that example for you. I'm like,
God.
Mom,
you're like, sorry, I wanted it anyways.
I made a plastic now. And, you know, I appreciate that was your intention.
That's sweet.
But you should have just done it.
Totally.
Because, anyway.
Oh my God, that's funny.
She got Botox and it did not look good because it got like spocky.
Yeah.
And she got it. And as the days are going on, I'm kind of like,
you're like,
oh shit, Mom.
Okay, so that's the other thing is like, I do feel like there's a fine line, right, between like prevention and correction. So like we want to prevent the lines from getting deeper because truthfully, I have women sit in my chair all the time in like their 50s and 60s that have never done anything. And I'm like, Botox is not your best value.
Like you need the facelift.
Not only that, but like maybe CO2 laser, like maybe let's focus on skin quality over just like freezing your muscles because your lines are so etched in the skin at this point that like Botox is not going to be the best bang for your buck. So
going into that question, does Botox help sagging and atrophy in the face?
Okay, does it cause it?
Does it cause it and then can it help it?
Okay, so this is like a little bit of like a...
Probably multiple answers.
Yes. Okay, so here's the thing. Botox causes atrophy of the muscles, and like we know that, and that's purposeful, and we use that to our advantage as injectors. Whether we want to like slim the face with masseter Botox, it atrophies the masseter muscle, or if we want to do like trap Botox for Barbie Botox to slim the shoulders. So we use the fact that Botox atrophies the muscle to our aesthetic advantage. Now, a lot of people took that theory and they said, oh my gosh, well, if Botox atrophies the muscle, if I'm doing it in my forehead, is that going to all of a sudden make my skin sag? The answer is no, because if you think about the bulk of the muscle in your masseter versus like the width of your muscle on the forehead, they're totally different widths. So like your forehead muscle is like, I think something along the lines of 0.25 millimeters, something really, really thin. That's the same as like tinfoil. So when we're talking about thinning a muscle that's already the thickness of tinfoil, you're not going to see the results on the skin from that. Like, it's not like that's holding your forehead up, you know? In the same way, like the masseter, for example, is a bulky muscle that is actually holding your tissue up. So if you have hypertrophied masseters and then all of a sudden you obliterate that, you could see some facial laxity from that muscle not being there anymore or being slimmer, right? So it's like a two-part answer where like, yes, it can cause muscle atrophy, but that's not necessarily a bad thing. And it certainly won't cause any ill effects on the skin. And just to like further qualify that, there was a really good twin study done with Botox where they compared one twin that got Botox for 15 years and one twin that didn't. And you can visibly see the difference in the twin that did. Yeah. And it's not like her face is saggy and droopy. If anything, it's quite the opposite. Her face looks amazing. So there's no ill effects on like atrophying the muscle when it comes to the upper face. Okay. So does that make sense?
No, totally. And I get what you're saying. It's also, it sounds like you apply or inject Botox intentionally.
Exactly.
It's like a puzzle.
Exactly. And that's where like not everybody is a masseter Botox candidate. In the same way, not everybody's a Nefertiti candidate. Like you really want to build that relationship with your injector so they can look at your unique anatomy and say, okay, you'd be great for XYZ.
And I got the masseter Botox and I didn't like it.
Yeah.
Because my face is already slim, but we're fighting the jowls every day of our life.
So you probably felt heavier.
I felt heavier, but my face was skinnier. But then I realized I was like, okay, wait, I don't necessarily need.
You don't need that because you have contoured cheeks.
Yes. So, but it was great because it helped with the TMJ. Yeah. Which is why I originally got it. Really was for that, and it did help it. But then I was like, oh, I don't love this face slimming look. And you did tell me that. I remember you being like, the only thing sometimes people say is their face was a little too slim. And I was like, hell no. Like, I don't.
You're like, too slim.
I'm like, no.
Well, that and that's like where, my cup of tea. That's where masseter Botox has become really popular because people see these amazing before and afters. And we have to remember, masseter Botox can be used both therapeutically and aesthetically. So we can use it therapeutically for things like TMJ, teeth grinding, or aesthetically for facial slimming. But we're going to dose it totally different depending on what your goal is. So if you have like awful TMJ, I'm not only going to dose you differently, I'm going to inject you differently. I'm going to go way higher. I'm going to make sure I get the belly of the masseter. So again, there's like so many innuendos when it comes to injecting that the common person wouldn't know. And that's why, again, like seeing someone that you trust that's going to give it to you straight is so important.
Yeah. Let's talk about the Nefertiti neck lift.
Yes, your favorite.
I got the Nefertiti neck lift. I'm obsessed with it.
It's the best.
I notice such a difference.
Yeah. So you are like a perfect candidate because you're a lower face animator. And so am I. I just had my bands done. So like they're starting to kick in where I feel like
sometimes when I'm eating, I'm like, whoa.
Yeah, I know.
I know. Got caught there for a second.
Exactly.
Like, she's in.
She's frozen.
She's activated.
So the Nefertiti neck lift is essentially where you place Botox along the jawline, including the DAO, which is the muscle that pulls down on the corner of our mouth, and then down the platysmal band. So it's anywhere between like 8 to 12 units per side. And these muscles of the lower face, they work to pull down on our face. So there are muscles that are pulling down on the corner of our mouth, down on our jawline. So when you relax negative muscles of the face, it allows your positive muscles like your zygomaticus in your cheek to pick up. So you get like a millimeter lift. Okay. And that's why it's termed the Nefertiti neck lift. You get like a little bit of a jawline lift. And then over time, cumulatively, you actually will notice less jowl formation in somebody that's doing the Nefertiti neck lift. So anyone that's coming in complaining of early jowls or saying, I see my mom, she has jowls, I don't want to have that, but I'm not ready for filler, incredible option. But It's very important to note that the results are cumulative because as you weaken those muscles, you're going to get less of that negative pull and more of that positive, but that's not going to necessarily happen in like one session. So I always tell people like one Nefertiti neck lift isn't going to leave you like boom, snatched.
Like high and tight.
Yeah.
And I've noticed that because I think I just did my third one with
Yes.
you. And the best so
Yeah.
far. Like
Okay.
I feel like I've actually, and everything's always a gradual
For sure.
lift. Since I've seen you, like I feel like my face has just gotten progressively better, which is
Yeah, you look
exactly why
incredible.
I go to you. But I've noticed in my, like I've really been working on
The side
preventing the
profile.
jowls and the side profile. And it's so true. You have to be consistent.
Totally.
And you also, I'm a big fan of the facial massage and the gua
Yes,
sha. Like I'm
yes.
religious with that 10 minutes every day.
You're so good at that.
I
I wish
really
I was
am.
better.
No, I really am. I mean, also I'm like single with no kids. So, and it's annoying.
Yeah.
Even
No,
with, like,
it's
it takes-
labor
it's
intensive.
oil, and then you have to
Yeah.
like wash your face, and it's like, you
It's
know,
a
it's a whole
commitment.
thing. But I really do swear by that. Can you gua sha after Botox?
You can, but you have to wait at least 48 hours. So, I mean, 24 is probably okay. I say 48 just to be extra cautious. We just don't want to manipulate or move that toxin somewhere that we didn't put it. So, like, for example, if we did the Nefertiti neck lift, you wouldn't want to move the Botox to the zygomaticus because then you maybe couldn't smile.
That's, yeah.
So, we want to be really careful not to manipulate the toxin. Most studies show that that toxin is set and it's in your muscle after about 8 to 10 hours. But again,
I wait
just
like
to be
4 to
extra-
5 days.
Yeah.
Just to be careful.
48 hours is good.
I'm like, nothing can move.
Yeah.
God
You're
forbid
like,
half
just
my
keep it
face
all
goes
in
frozen.
place.
I know. I always get like, I'm just always extra cautious in that realm because
Good.
it's so scary. I don't think this is
Totally.
talked about enough. I mean, I know Botox and filler and all the injectables, it's so common, but you're walking in somewhere and you're getting your
Totally.
face changed.
100%. And also with Botox, it's even scarier because you don't see it right away.
Yeah.
So you're like, okay, I hope in 10 days I look okay.
Okay, let's say someone's listening right now.
Yeah.
And they got Botox and they're not loving it.
Okay.
Okay. Let's say they have a weird, maybe a spocky brow.
Okay.
What would be your recommendation for them?
Yeah. So number one, I always say go back to the injector that did it. Like I do, unfortunately, inherit a good amount of patients that are like, can you fix my Botox? And as much as I would love to, I think it's so important to go back to the person that did it. So number one, they can learn and they can see what they did wrong. And number two, like give them a chance to correct it. 9 times out of 10, there's something that can be done. And I always remind people of that. I'm like, if you in 2 weeks aren't in love with your results, or you just feel like you're looking in the mirror and you're like, I don't love what I'm seeing, come back. There's almost always something we can do, whether it be a brow lift, 1 unit over the brow to calm down spockiness, even out the smile. Like, I don't know if you listen to Giggly Squad. Did you hear about Paige's incident?
Yes.
Okay, so with her DIO, basically she inadvertently hit a muscle called the DLI that she did not mean to hit, but she was able to hit the DLI on the other side and even out her smile. So
Okay.
even if it was like a less than ideal result and you hit the wrong muscle, there's normally always something we can do to like even things out. So that would be my advice.
That's
is like
comforting.
go back to the injector. And then like if you go back to the injector though and they're like, I don't see a problem, then obviously like go somewhere else. But like I always appreciate if somebody comes back and is like, hey, like I felt like this side was like raising a little higher. It's like, oh my gosh, great. That's an easy fix, you know?
It's comforting to know that you can make little other manipulations with
Totally.
Botox because you can't reverse it.
100%.
But you can reverse filler.
You can. And that's why, like, with Botox, I tend to be, I would say, a little more cautious than most and, like, maybe even a little bit of an underdoser when it comes to neurotoxin on new patients. Like, until I've injected you a few times, like you, I'm like, you know the drill,
Oh,
girl.
I'm needle happy. I'm
Yeah.
like, the more needles, the better. I want to hear the crunch.
I know, the
Don't know me.
crunch. You
I
love
want to
the
feel the
crunch.
needle going into. I'm like weird.
You are.
Like I seriously think it's like,
You, like, literally lay there, you're like, ah.
like I feel so at peace. I feel the spirit. I feel the spirit in your office. Sister in Christ over here.
Oh
I'm
my
like,
God. It's like those memes where it's like me coming to life after
oh,
Botox.
Yes.
No, but Botox is irreversible in the sense that like there's no antidote. Like you can't take it away once it's been placed. So I do tend to underdose because again, dose equals duration. And before I know someone's anatomy and I know how their muscles move and I've injected them like 1 or 2 times, I tend to just be a little more cautious. That way they come back at 2 weeks. We see how things look. We can always add more, but we can't take it away.
Yeah.
If you feel heavy, if you feel hooded, if something poor happened with your outcome, you kind of are stuck waiting 3 months for that to go away.
Yeah.
But filler is reversible. So filler has an antidote. It's an enzyme called Hylenex, and it eats away at the filler. So you can dissolve the filler if you don't like it. I would say though, I feel a little bit like this day and age, like people are getting a little dissolve happy. And we've talked about this before, where I feel like there's some clinics that have said like, you need to dissolve all your filler and start over. I don't think we should be relying on dissolver in that way. Like, I think dissolver should be used judiciously. And like, my goal for my patients is to never dissolve. Like, I don't want to ever have to dissolve my work. If it's properly placed, if it's in the right depth, if it's strategic and precise, we shouldn't have to dissolve it. And I don't think we should use that as like, oh, don't worry, if you don't like it, we should just dissolve it. It's like, well, no, like we should aim to get it right the first time and not dissolve, because dissolver is a little bit like a wrecking ball. Like, it goes in and it just dissolves whatever's in its path, and it's not super precise. So dissolver's there if we need it, but I don't like...
It's like a tool in the toolbox.
Exactly.
Yeah, no, I love that take, because I think just being in like the influencing realm, I've seen a lot of influencers kind of do like a come get my filler dissolved with me. It's kind of like
trendy.
Yeah, it is a trend.
Yeah, I
would say. And it's also very painful.
Totally.
From what people have said. I've never had anything dissolved.
Yeah.
But
super painful.
Yeah.
It's like anything. Like, tattoo removal hurts more than the tattoo. Dissolver hurts more than the filler did. Like, any antidote is often more painful than the actual procedure was. But again, my goal for all my patients is not to dissolve. Like,
I love
it's
that.
there if we need it, but that's not my goal.
Okay. And I think that just goes to show too that you are a cautious injector.
For sure.
Which is such a green flag. Because like I've said, I just said this, it's so scary going to someone new, or if you want to try something new.
Totally. Yeah.
And I'm sure it's hard for you sometimes, because like everyone looks so different. And so if someone comes, they're like, my best friend just got this, you're like, sweetheart, your face is not meant for that. Yes. And to piggyback off of that, one thing, I just remembered this from that story. I came into you and I wanted something. I can't remember exactly what it was, but I had seen someone get something, and you straight up told me, you're like, listen, you don't have that naturally, so we can't enhance that.
Okay. And I forget what it was.
I can't remember what it was. I think it was something my nose, maybe.
Okay.
Because I was like, I've always been I've talked about this on the podcast, but like a little insecure about my nose sometimes. And it was something to do with like, you can get Botox or filler in your nose to like even it out a little. Yeah. And you just were like, you don't naturally have that slope, so I can't create that for you.
Totally. Yes.
How refreshing to hear that, because I was like, okay, like that makes sense.
Yeah. Well, and instead of a patient endlessly chasing something that they think they can achieve, I think it's really important to be honest with them. Like, there are patients that want Kylie Jenner lips that I'm like, you will never have those. Like, unfortunately, your anatomy doesn't allow for that, you know? And that has to do with your tissue size, your tissue strength. Do you have tight lip tissue? Do you have loose lip tissue? Like, there's so many things we have to take into account. And I would always rather lead with honesty again, and just be like, listen, I personally can never achieve that for you, than like lead them astray and be like, yeah, just keep doing filler, girl, we'll get there. Like, no, that's not plausible.
You enhance.
Yes.
Which is such like one thing that also makes you stand out. What are things you should not do after getting Botox and filler?
Okay, so Botox, 3 rules: no laying flat for 3 hours, no working out that day, and no facial manipulation, like we said, for 48 hours. So no like gua sha, jade rolling. After filler, a little bit longer. So no elevating your body temperature and no exercise for 48 hours. So anything where you are revving up the heart rate or elevating your body temperature is going to make your filler swell in those areas. So nothing bad will happen. I always tell people, like, you're not going to ruin it, but we want to set you up for success and have your filler settle in the best way possible. So minimizing swelling as much as possible is ideal. And then again, the gua sha, the facial manipulation with filler, is for at least a week. Freshly placed filler, we don't want you to get any facials, because if they're massaging during the facial, we don't want to move that. We just want everything to like heal on its own.
Okay. And with filler, this is like just a random question I just thought of. When you fill something on someone's face, does it expand, or does it just literally go directly into that place and stay there?
Okay, so filler is a hyaluronic acid gel. So it goes right to where you place it. So if you place it on bone, it's going to stay on bone. If you place it in the muscle, it's going to be in the muscle. But over time, because it's hyaluronic acid, it draws water to it. So that's why people that have had lip filler, for example, sometimes they go to the mountains and they become dehydrated and they're like, why did my lips swell? And it's because there's hyaluronic acid in there and it drew the water to it. So over time, you can see fluctuations, and it's minor. It's not like you go to the mountains and you're like, oh my God, it would be
I'm
minor.
going to the mountains, baby.
Yeah. It's minor, but it's to the point that like you could notice it. You could notice a difference. But that's also why like when it comes to areas like the lips, going low and slow and filling them slowly over time is ideal, because filler does have a tissue expanding property where over time, as it sits in that tissue, it can slowly expand the tissue, which could allow us more room to fit more filler if you're trying to build your lips out.
Okay.
So like if you came in with like paper thin lips and we're really trying to build them up, we would want to do that very slowly in multiple sessions instead of just like jamming a full syringe in there.
Okay. That makes sense. Under eye. I want to talk about the under eyes.
My dreaded under eyes.
This is, I mean, I've never dabbled with the under eyes because
Yeah.
I've heard too many horror
Yours are great.
stories. Thank you. I mean, there's sometimes as I'm getting older, there is a little bit of like a hollowness, but I'm trying to do more of the topical
Totally.
route because
Yeah.
it's not somewhere that I feel like I need to
No,
target.
you don't.
But I've heard so many horror stories,
Yes.
not only from just people online, but my
Yeah.
friends. I've only heard of 2 people that I know of that have loved under eye filler.
Yeah.
I feel like every person I talk to,
Is like never do it.
yeah. So what is the, like,
Yeah.
give me all the under eye details.
Okay, so anatomically speaking, in almost every area of the face, we have different fat compartments. And those fat compartments are where we want to ideally place filler, right? So our fat compartments of the face, they thin and they slide down as we get older. So they not only like descend down, but they also deflate. So when we're placing filler, our goal is to replace where that fat pad used to live. So for example, our malar fat pad shifts downward. So when we're doing cheek filler, we're aiming to replace that malar fat pad. Now, when it comes to the under eyes, we don't have a compartment like that. We literally only have 3 layers. So we have the bone, we have a ligament, and then we have our skin. So there's no area for filler to safely live in the under eyes where it's not going to migrate. Like it's not gonna, there's no compartment, there's no contained space where filler can safely live long term. So I've seen some of the best injectors inject under eyes and still have it go wrong. And I'm not too proud to say that, like, listen, if the best of the best can achieve it, I certainly can achieve it. And I don't like doing a procedure where I know almost 98% of the time it's going to need to be dissolved at some point. So going back to what we said earlier, I don't want to dissolve my work. Like ideally, I want to do things that are going to be long lasting and be sustainable for patients. If I'm doing a procedure where I know almost with certainty that it's going to have to be dissolved, that's not my cup of tea. So that's the reason why I don't do a ton of under eye filler, is just because in most cases, it does have to be dissolved at some point. And you might like it for 6 months, a year, 2 years. At some point, though, that filler is going to migrate either superficially, it's going to slide downward and cause that wormy effect that we see, something called the Tyndall effect, where it migrates so superficially that you see this like bluish tinge to the skin, and it almost looks like dark circles when you didn't originally have them.
Oh my gosh.
So there's just so many things that can go wrong in the under eyes. And I think initially it was like a fearful area to inject because it is very vascular. There's a really important artery that comes out right under our eye. But even the artery aside, I just think anatomically, it's not where filler is meant to live. So I think there's so many other regenerative options, things like PRF, PRP, Easy Gel. Now we have Fraxel, CO2, things where we can tighten and brighten the skin without actually having to inject filler. So
with everything you just said, the PRF.
Yep, Easy Gel, PRP,
What
they're
is
all
that?
kind of like interchangeable. So PRP, platelet-rich plasma, platelet-rich fibrin matrix, and then Easy Gel are all just different renditions of our body's own growth factors. So it's where we draw your blood, we spin it down in a centrifuge, and we inject your own platelet-rich plasma, which is packed with your own growth factors, and that stimulates your collagen. So like on a more natural level, some compare it to like Sculptra. It's not Sculptra because it's obviously a different molecule, but it's regenerative in the same way. So it's going to help build collagen. It's going to lighten and brighten the under eyes. So I always remind patients too, like filler is only filling. Filler's only occupying space. It's doing nothing for your skin tissue or your integrity. If you have crepiness, dark circles, filler is not going to help with any of that. PRF or Easy Gel 100% will.
Is there downtime after that?
There is. So it's injected similar to filler. So unfortunately, I use a cannula and I just inject it right in the under eyes. But you can have some mild bruising. Swelling is very normal. And then it does take multiple sessions. So again, like we're in this Amazon Prime culture. Everyone wants things right away.
Yeah.
PRF, Easy Gel, they're the long game. Like you have to do anywhere between like 3 to 5 sessions to see results. And people just get impatient. They're like, okay, I did 2 of these, Molly. I'm not seeing results. But like over time, you will see results. It's just slow.
Sessions, like how do you space them out?
Like 4 to 6 weeks.
Okay, so that's nice. It's not like a year or.
Totally. And like I have a lot of patients that did like let's say a series of 3 and now they're maintaining and they're just doing it like 1 to 2 times a year for maintenance because they love the results. So let's say they have a big event coming up, they'll do Easy Gel like a month before that event because that's when their eyes look really bright. So it's just such a good option. And even Easy Gel and PRF aside, there's so many lasers too that can help with skin integrity. So I just think there's too many other options now that like we don't need to rely on filler as much.
Filler's kind of out or under the eyes.
Under the eyes,
feel like it's kind of going off from what you're saying.
Yeah, and if you do want to get under eye filler, which trust me, there are some people that are just like they've just got hollow under eyes genetically, and they maybe are a really good candidate for a little bit of filler. Go to somebody that like that's all they do. Like I send a lot of patients to Dr. Jeffrey Joseph here in Newport. He's amazing. He's an oculoplastic surgeon, or Dr. Ira Vidor. They're both oculoplastics. They are so like uniquely familiar with the under eyes. They're obviously doing surgery on it every day, so they know exactly where to place it.
They really see under the hood
to set you up for success. Yeah.
Okay, that's good to know.
Yeah.
In terms of kind of going back to what you were saying with the facial treatments.
Yeah.
CO2.
Yeah.
I am on my phone at night doom scrolling these CO2 videos.
Hannah, you don't need CO2.
No, not yet. Not yet. But like, what the hell? I mean, honestly, I don't know if I could ever do it. It's absolutely terrifying.
Yeah.
No, it's not even like, if anyone's listening right now and you don't know what the CO2 facial looks like,
it's crazy.
Pause this. Make sure
you
to come
look like
back.
a burn victim.
Go watch a video. No, it's like actually
like 3rd-degree burns. Yeah. It's
what
crazy.
is it?
Okay, so CO2 is a fully ablative laser. So when we talk about lasers and like the physics of lasers, we have ablative and we have like semi-ablative and we have fractionated. So we have all these different kinds of energy sources. Ablative means that it is damaging every skin cell in its perimeter. So like, let's just use like a square, for example. An ablative laser is damaging every single ounce of that square, whereas a fractionated laser is damaging like 60%.
Okay.
So it's leaving some intact skin cells. So things like Fraxel and Moxie are fractionated energy. So they leave some intact skin cells, aka less downtime, but still really amazing results. CO2, in my opinion, is like the big guns. Like that is like really severe.
It's surgery,
it's
right?
a lot of times done under anesthesia. Like my old plastic surgeons that I worked with, they would do it literally while you're under anesthesia because it's that painful. But here's the thing. Again, I think people reach for like, oh, it's super aggressive, so that much must mean better results. That's not always the case. Like I always use this example and analogy that like we don't need to bring a machine gun to a sword fight. Like we don't always need the biggest guns in order to combat a problem. So these young like 20 and 30-year-olds that don't have horrible tissue laxity, sun damage, really deep lines, they don't need a CO2 laser. They just need like maybe a few Moxie treatments, you know? So that's where I do think that you could actually cause damage by doing something too invasive that your skin doesn't really need. But it is amazing in the right candidate. And the right candidate would be like somebody in like their 40s, 50s, seeing those like really, you know, deep signs of texture, the pewter orange appearance on the chin, really deep lines that are like set in the skin. That's a really good CO2 candidate.
Okay, that's good to know because I see a lot of girls like,
I know.
Honestly, like, I mean,
young.
I'm 30, but 35, 37. Like I know someone that is 37 that just got it. And it's sometimes it's like easy to be like,
do I need that?
Do I need that?
Totally.
The results are absolutely incredible. Yeah. But I do agree with you that it's good to know there's a time and a place.
Totally. And I do think there are some newer lasers coming out, like Cool Peel is one, Cool Peel's one that is like titratable. So a lot of the CO2 lasers, you can titrate up or down. So you can change how much skin you're damaging.
Oh, okay.
So there are some new devices coming out where they're like a mini CO2. Those are not what I'm talking about. I'm talking about like full-on, fully ablative CO2 laser is like really, really intense. And I would reserve that for like a very specific demographic.
Yeah. There's a girl I follow, Sarah Jane Warner. Do you know who that is?
I don't know who that is.
She's in Utah.
Okay.
I don't know her, but I just watched her CO2 journey. I'll show you.
Was it insane?
Insane. I mean, her skin is unbelievably perfect.
Totally.
She's so beautiful and has just the most like beautiful face
Flawless,
to begin with.
yeah.
But watching her journey, she was like one of the first ones I saw, and I was like, what is this?
You're like
this is
add to cart.
crazy. I know. Well, after, but during it, I was like, oh my gosh. I mean, her video went viral.
Oh, I'm sure.
Like,
Because it's jarring. Like, you're like, I can't believe people do this.
Yeah. So I had to ask about that because I've been seeing that everywhere.
Yes.
Okay. So in the realm of the face, I feel like a lot of people struggle with jowls.
Yes.
Like most of my friends, I feel like it's the lower half of the face that is complained about the most, and just the jawline. What do you think about, like, is there a perfect remedy when it comes to filler and Botox for creating a more structured jawline?
Okay. So jowl formation, when we talk about a jowl, we have to address like the 3 reasons why we have a jowl. So number 1, muscular. So we talked about this earlier with the DAO muscle and the platysmal bands that pull down on our face. Those are negative muscles that could potentially cause like some skin bunching and like some heaviness in the area. So I refer to it as like a pseudo jowl. It's not truly a jowl yet, but like that negative pull is causing like some tissue heaviness, right? The second thing is that fat pad deflation and descension that we get. The fat pads are slipping forward.
That's my issue.
That is also creating a little heaviness in the jowl. And then lastly, collagen loss. We lose like 2% of our collagen annually after the age of 25. So those 3 factors are the reasons why we start creating jowls. So in order to combat jowls, it's kind of a multifaceted approach, right? We have to start with neurotoxin to help with the negative pull. We have to look at filler to help with the fat pad deflation and descension. And we have to look at collagen stimulation, things like Sculptra, which is why I think you love Sculptra so much, because you actually notice that lifting and tightening of the jawline. So Sculptra, microneedling, Moxie, any sort of collagen induction therapy that's going to help build collagen will also improve the jowl. So it's kind of a multifaceted approach.
It takes a village.
It does. It truly
It
does.
really does. Now, going into Sculptra.
Yes.
I love Sculptra.
I do too.
Can you explain Sculptra to like a kindergartner?
Yeah. Sculptra is a fertilizer for your collagen. So it's essentially little tiny fertilizer beads that we inject all over the skin, and we inject it globally. So unlike filler, where you like pinpoint it and you're like, okay, I see volume loss here, that's where we're going to put the filler. We inject Sculptra globally all over the face because we want to build collagen everywhere. We didn't lose collagen just right here. We lost collagen everywhere.
Right.
So that's where Sculptra is approached a little differently than filler. It's approached more full face, and it's mixed with water. So we literally inject it all over the face, and normally 1 vial is equivalent to like roughly 9 cc's. So that would be like 9 syringes of filler.
No, when I came in to get Sculptra, I mean, I love a needle.
Totally.
But it was a lot.
It was a lot.
I think people need to know, like, I mean, it goes in far and then you wiggle it and it doesn't hurt.
Totally.
A little uncomfortable.
It's eerie.
I think it's more like just the vision of it.
Totally.
But
no, and it's like, it's not for beginners. Like I always say, Sculptra is like, you want kind of like a seasoned person that's like familiar with aesthetics. They've like done some Botox, some filler before, only because like it is kind of an intense procedure. I've had it done myself, and I was like, oh, like I can empathize a little more with patients because like this is not the easiest. But no, Sculptra is incredible. It's like literally anyone with skin is a candidate for Sculptra because it builds your collagen.
Yeah.
But back to that point, like Sculptra essentially works globally to build type 1 and type 3 collagen, and that can help tighten the skin, help with volume deficits, and just overall improve the appearance of the skin.
Wow. That's amazing, because a lot of people, I've said, like, I talk about Sculptra and I've recommended it to people and they're like, oh, I don't want filler. And I'm like, no.
It's not filler.
It's literally just collagen.
Yeah.
Like, it's amazing.
Yeah. And I think like there's 2 myths that I can debunk really fast with Sculptra. Number 1 is people like get really fixated on the fact that it's irreversible. Mm-hmm. That's true, because it's building your own collagen. We don't want to reverse that. So I always say like, the results that Sculptra is building are your own collagen. We don't want to reverse that, so that's a good thing, right? And then part 2 is people always ask, like, I've heard you can't get a facelift if you get Sculptra. If you're planning to get a facelift within like 3 to 4 years, don't do Sculptra, because it's going to build that collagen, which in a way acts a little bit like scar tissue. It does not take you off the table altogether for a facelift. If you are getting Sculptra right now in your 20s or 30s and you want a facelift in your 50s, completely fine. That is like a huge myth that I always hear. And I'm not really sure where it came from, but I've worked with plastic surgeons. It's totally safe to do sculpture and then a facelift down the road.
Good to know.
Not that we're getting facelifts.
I like this. Twist my arm. No. Well, that's my next question. What's your take on like the mid 30, early 40, quote unquote, mini facelift or full facelift?
Yeah. I mean, again, I kind of feel the same that I do about the CO2, where it's like, do we need these really big guns, these really invasive procedures? Now, I think everyone's so different. I've seen 30-year-olds, let's say 37-year-olds that have a lot of tissue laxity. Like I pull on their tissue and their skin comes so far off their face like a puppy dog where I'm like, wow, like you actually could be a surgical candidate. And like, I'm honest, I'll say that. If it's something where like, I don't think sculpture or anything else could help with, like I will 100% be honest. But it's not cookie cutter. Not everybody in their 30s and 40s need to start considering a facelift. Like I think it's just so person dependent.
Yeah. I think that's one kind of general takeaway is just how situational
Totally
all these treatments are. I want to talk about something that I struggle with because it's an ongoing issue, as you know, like melasma and hyperpigmentation. Yes. What a bitch those are.
Girl, same. Especially coming off pregnancy. I'm like, I'm
terrified. No, I'm
terrible.
terrified of the acne and the melasma that's going to happen when I'm pregnant.
Okay, a lot of people's skin gets better pregnant though. So
please, Lord, let that be my journey because I swear, like, when I'm pregnant, I'm just, that's going to be tough for me.
It's hard.
The melasma is... It comes back with vengeance every summer.
Yeah.
I'm on Accutane and I will say the Accutane helps the melasma.
Okay.
I don't know if that's like a side effect of it.
Yeah, it normally isn't. If anything, kind of the opposite, only because it makes you sun sensitive. So it could potentially make the melasma worse.
I don't understand it. It's so, I mean,
it is a vitamin A derivative, which is essentially retinol. So it's just making your skin glow.
But when I'm off the Accutane or even like, I mean, I put on sunscreen every day. I do not put my face in the sun. I am so sensitive to that now because I wrecked my face in my early 20s from so much sun exposure, which I talk about every podcast. Like if you're listening, just wear sunscreen on your face.
It's the bare minimum. Wear
literally,
your sunscreen.
I just look back at myself frying my face in the sun and I'm like the damage that I'm trying to undo.
I know.
And I don't think people realize like when I have no makeup on, I have so much scarring. Like hyperpigmentation, tons of little dots.
Yeah, freckles.
That's why I use the freckle pen too, because it kind of like blends them all together.
Yeah.
So what do you do for melasma?
Yeah.
How do you tackle it?
Oh, melasma is like, we used to joke in dermatology, it's like the bane of dermatologist existence because it is so challenging. You can do everything right and still have a melasma flare. So even as somebody that has access to all of these things, like I struggle with melasma every single day because even if you're doing everything right, raising your body temperature can flare melasma. The sauna can flare melasma. They've even studied like fluorescent lighting can flare melasma. So I always tell people, like, don't change your life simply because of your skin. Like if you are loving hot yoga, please don't stop that strictly for your skin. Like that would be sad to me. But there are a few things we can do. So like, I guess starting from least invasive to most invasive, the least invasive would be like at-home products, right? You can use retinol and hydroquinone, which are very strong bleaching agents for the skin. They're highly effective for melasma, but you have to take drug holidays. So you have to take breaks from it. It's typically used 12 weeks on, 12 weeks off. So hydroquinone is very well studied, very safe, but you do have to take breaks from it. Otherwise you can get rebound hyperpigmentation where it comes back with a vengeance. So that's amazing. Kojic acid, tranexamic acid are all amazing. And then like a step up from that would be like in-office procedures. So starting again with least invasive would be like a chemical peel, things like Perfect Peel. Cosmelan is a really good chemical peel that's a little more intense. It's actually about a month commitment because it's a 2-step process. You do the chemical peel and then you use like the at-home products for an additional 3 weeks. And it's a mixture of retinoic acid, kojic acid, hydroquinone, and like a few others.
You're like a textbook. Well, you're so sweet. I'm like watching you talk. I'm like, you should have a podcast.
I'm like, tell me if too much of this is like over.
No, I'm like, I'm
just
sponge.
spewing my medical knowledge. And then the Perfect Peel is the same thing, but it also has phenol in it, which is like a nice skin brightener. So chemical peels are great. And then a step up from that would be lasers. So things like Moxie laser. Anyone out
wanna
there
do that.
watching, do not get BBL if you have melasma. BBL or IPL are not safe for melasma. I have so many patients that have come to me that actually caused their melasma. So not all lasers are safe, but Clear and Brilliant, the Premea handpiece, and Moxie are safe for melasma, and they actually look for water in the skin, so their target cell is not a pigment cell, so that's why it's totally safe to use on melasma patients.
And is melasma caused by, is it a hormone? Okay, a hormone
It's
thing.
hormonally induced pigment, so that's why men don't get melasma.
Of
Of course. I'm like, of course
Love
you
that
don't.
for them.
I'm like, this is just unfair. I swear God should give women perfect hair and perfect skin after having babies. Because
Perfect body. Throw that
everything,
in there.
throw that in there too. Like, we went through enough. But no, melasma is really tricky. And I always say, like, there's no cure for it. We can control it. We can't cure it. But I would say, like, starting with at-home products and nailing down your skincare routine at home. And then, of course, like, sun protection and prevention is key.
Okay, noted. I cannot wait to do some of those treatments when I'm off Accutane.
Yes.
Because the only skin treatment I've ever done that's more invasive than like a chemical peel is microneedling.
Oh, yeah.
Once.
Wait,
but
did we do that or
no? I did this at a spa. This is a while, probably 3 years ago. But I had active acne.
Oh,
and it was not good.
Okay, you'd be such a good candidate for Moxie.
I want to do that after Accutane.
Yeah, you're gonna love
at the
Moxie.
end of this year. Like, I really want to start to lock into more of the facial treatments because I'm manifesting that this second round is gonna wipe my acne for forever.
It will.
And then I'll start working on all the little skin impurities.
Imperfections.
Yes.
Yeah.
Okay, I had so many questions coming from girls who want your job. They want to be in aesthetics. They want to work at med spa like Skin Spirit. So how do you break into aesthetics, and like how did you establish yourself with where you're at in your career now?
Okay, I feel like this could be an entire podcast episode, but this question, I want to go a few different ways. So first, I'll just talk about my experience. After graduating from PA school, I got really lucky and I landed a job in dermatology. I was making 40 to 50% less than my colleagues. Wow. And I did that on purpose because I was like, I know that getting this experience is going to be invaluable. I call it my mini derm residency. I learned everything from skin cancer detection, surgery, Mohs, biologics, and then of course aesthetics, laser physics. I learned everything about dermatology, and that was invaluable to me. So I was like, I'm willing to take the pay cut for 2 years and just like grind it out. I was working at the time 7 days a week. I was working Monday through Friday in medical derm and Saturday, Sunday in urgent care to pay off my student debt because I was making such poor money at my medical derm job that I was picking up shifts at Cliniva and urgent care. And I did that for 2 years straight, 7 days a week.
Wow.
So that was like worth it to me. And I do think anyone trying to break into the industry, knowing that like you may have to sacrifice a pay cut in order to really break in and get the knowledge that you need to, because unfortunately this stuff isn't taught in school. Nursing school, PA school, you have one little section on dermatology. They don't teach you about aesthetics and injectables. It's all a little bit self-taught, and it's like hands-on experience that you have to get. So number one, taking a pay cut and being okay with it for a little while is key. Number two, finding a mentor is huge. So like just finding someone that's willing to like guide you and give you tips and tricks. Number three, and something I didn't realize, is investing in yourself. Like my first 3 years in aesthetics, I probably spent $15,000 on trainings out of my own pocket. So if you really want to get good in this industry and you want to excel and build a book of business, you have to invest in yourself. And these are like trainings that are not covered by the drug companies like Allergan and Galderma. These are outside trainings that I flew to and did on my own accord because I wanted to learn everything I could. And then kind of going off of that is knowing that aesthetics requires a very unique personality where you are so self-driven and you're willing to like almost in a way build your own mini business. So unlike any other specialty in medicine, like you have to market yourself. And like we didn't learn that in PA school or in med school, you know, like we learned about the medical side of things and knowing how to manage Instagram and build a book of business and retain clients and answer DMs. Like there are so many days where I'm like, I would love to just go in and like see my patients and go home. But like there's other stuff to be done if you want to be successful. So I think just from the outside, it looks so glamorous. It really does. And people always refer to aesthetics as like soft medicine. I think that is the biggest misconception because I have lost more sleep in my aesthetic jobs than I did in like urgent care. So
I believe that.
Yeah.
Especially in the demographic that
Totally.
we're in, and just being in Orange County.
Well, and I always say if you care and you're a passionate injector, like you should be losing sleep. Like you should be like, I hope her brows are perfect. I hope her cheeks settle. Like these things should keep you up at night if you care, you know? They always say there's like a saying in aesthetics, like when you stop learning is when you should put down the needle, because like this is such an ever changing, ever evolving industry. And if you are not growing and changing and evolving with the trends, then like you're behind, you know?
Wow. No, that was very well answered.
Thank you.
I didn't even realize everything that you've done. It all makes sense though, because you are, like I said, such like a wealth of knowledge in this area. Last question before we do a little rapid fire.
Yes.
What are your thoughts on Accutane?
I love Accutane. I think it's amazing for the right patient, again, as always. But no, I come from medical derm. So obviously with my medical derm background, I saw patients who were just riddled in cystic acne, deep, painful lesions covering their face, neck, chest. And it was life altering. I mean, truly, like these people were in tears. And I always tried to remind the parents that acne's not forever, but acne scars are. And like, even though that sounds really superficial,
I'm gonna
like
clip that.
Yeah, like we
so
know that like once those scars are there, like they're gonna have to live with those their whole life. And like that's one of the number one concerns I see is like my scarring bothers me. Like I had really bad acne as a teen, and like I've never been able to like feel confident in my skin. And like hearing that from like 30 and 40-year-old adults that are still bothered by that makes me want to go back and hug their 10-year-old self that like struggled with that acne. So if Accutane is something that's being proposed to you and the dermatologist thinks you're a good candidate, by all means. Like I don't want to blanket statement anything. Like obviously it's not for everybody, but for really severe cystic acne and for the right patient, I think it's absolutely life-changing.
Yeah, no, and I'm living it.
Yeah, you're like, I'm a walking billboard.
I know. I am on my second round, but I would say I did my second round because I started to feel small ones come back.
Yeah.
And because my dad did three rounds, like I was just like, you know what? I'm going to just do it before I have kids, before I'm married. Like obviously Accutane's a serious like drug and you have to take it seriously. And it's kind of stressful in that area. But there's so much fear mongering with Accutane. I mean, I was terrified to do it. I just got to a point though where I was like, I will literally do anything.
Yeah.
And
like, that's the thing, like all the fear mongering around it, like I could go through each side effect and debunk them, but at the end of the day, like trust your dermatologist. Like all of these side effects are very short-lived and they're limited to the time that you're on the actual medication. It's not like you're going to have permanent liver damage from it, you know? So these are all things to take into consideration. But risks and benefits, you want to always outweigh them. And in most cases, the benefits outweigh the risks.
And going off what you just said, I mean, I get my blood work done every 6 weeks.
Right.
You're
more on top of it than the average person.
Yes, because I understand that if I am taking this,
totally
intense medication or whatever, there are like side effects. So I want to make sure that like everything is good and working properly. But,
and like you don't drink, like you're doing all the right things where it's like, I know people who have been on Accutane that drank the whole time and it's like, okay, well, maybe that isn't ideal because obviously there's already liver damage happening from the Accutane.
Yeah.
So following the actual guidance from your medical provider is huge.
Is important.
Yeah.
Okay, let's do a little rapid fire Q&A. Biggest aesthetic mistake people make in their 20s?
Ooh, probably just like copying their friends. I feel like if their friend got a lip flip and they got a lip flip, like not everybody needs the same procedure as their best friend.
That's so true. And I've done that.
Yeah.
Mine was the lip flip.
Wait, I think that was maybe what we were talking about because I also anatomically, my lip flips out.
Yeah.
So when I did lip flip, I looked like this.
Oh.
I looked like a grandma. And so not everybody's a candidate for lip flip if you're listening.
No, me trying to drink out of a straw. And I'm broken. I can't drink water normal.
Yeah,
I need a straw. And I did that. That was one of the first things I did early on. And I'm like, this is not my journey. My friend was obsessed with it. It looked great on her. Mm-hmm. Did not work with me.
Yeah.
What trend in aesthetics do you wish would go away?
I don't know if this is like a trend. I guess just like people listening to the internet more than their provider. Like, I know that's not like an aesthetic trend, but like just like the amount of TikTok knowledge and like people coming in, like there's this new like ZERF procedure out that Kim Kardashian did, and just like now everybody wants ZERF, and it's anyways, I think just like the amount of information out there and like people listening to like the wrong sources rather than like the provider that's in front of them ideally looking out for their best interest.
What is ZERF?
Surf is this like radio frequency device, and it's supposed to cause skin tightening, but in like a lot of the before and afters, they posted the photos immediately after, which if you exert any level of heat on the skin, you're gonna see skin tightening. So like they're kind of like false before and afters, but everybody's talking about it. Everybody wants surf right now, and I'm like,
wow, that's like when I go in the sauna though. When I get out of the sauna, the lips are plump, the skin is tight, the melasma's flaring. But I'm like,
you don't need surf, you just need sauna.
Okay, what is the most natural looking tweak most people can do?
Botox.
Okay. I love Botox.
Yeah, it's so great. And like you can titrate the dose, you can make it look less or more. It's great. It's amazing.
One question I just thought of, there's a few different types of Botox.
Yeah.
And I've only ever had Botox, but there's like Dysport.
Botox, Dysport, Xeomin, Jeuveau, Daxxify, now Latibo, and I believe there's 2 more coming to market this year by Galderma.
Wow.
No, one by Allergan, one by Galderma, I think. So yeah, there's going to be, like 8 or 9 neurotoxins on the market. They're all basically different renditions of the same toxin. They're bound to different things, different proteins, not to get too much into the nitty gritty, but some have different longevity profiles. Daxxify, for example, lasts a little bit longer because it has a peptide in it. That's actually something that we should think about because you love peptides.
I know.
And there is like a little bit of like a skin glow side effect with Daxxify that people love. And we've never tried it on you.
I'm so down to try
maybe
that.
we try that next time.
Well, it's funny because the other day I was watching an Instagram reel of a girl who she's like getting Botox, but she's like, oh, I get Daxxify, I work out a lot.
Yeah.
I had acne, and I was like, oh, check. Like I had the same things. So I was going to ask you about that.
Yeah.
Which I would love to try.
Yeah.
Would you say you kind of mainly use 3 or?
We only have Botox, Dysport, and Daxxify at Skin Spirit. And like, I truly feel like any more than that, like it's too much to offer. And like, it's almost like a kid in a candy shop where it's like, oh, to go over 8 different neurotoxins with patients.
Overstimulating, it's overwhelming.
They'd be like, I don't know, you tell me. And most of the time patients are like, cool, like, yeah, just use Botox, you know, like they just want to use whatever's best. So I do feel like a little bit like everyone wants a piece of the pie. Everyone sees how lucrative the Botox industry is, the neurotoxin industry is growing, that every company wants a little piece of that. So they come out with their own version of neurotoxin. Okay,
noted. What lip filler technique do you think is the best?
I think looking at the patient in your chair. I don't think that there's any one technique. I do kind of a mixture of like fencing and like a little bit of like, some people call it the Russian technique, where I'm like lifting linear struts up to give the lip vertical height rather than protrusion. So I'm always trying to give people height and decrease the width between like the philtrum columns, rather than giving them like side projection, because nobody wants to look like ducky or have protrusion. But I think truly it's different for every single person. I inject every lip differently.
Okay. And then last question. This isn't the one that I had, but I just thought of it because I'm curious.
Yeah.
If you could only do one thing to your face, like for the rest of your life, if you only had one option, what would you keep doing?
Probably Botox.
Okay.
Honestly.
We're just Botox bitches over here.
Especially at this age. Like
it.
if I were in like my 50s, maybe I would say like microneedling, but Botox, it's the best. I mean, it gives you your skin that glow. It diminishes pore size. Your skin looks glassy and amazing. Like, what's not to love?
I know. I just got mine. When did I come in? Like 2 weeks ago?
Yeah.
3 weeks ago?
Yeah. It's the best.
When day 14, when I arise, when I look in the mirror, I'm just like, she's back.
It's amazing. Mine just kicked in too, and I'm feeling myself.
Where can everyone find you?
Skin with Molly on Instagram and Skin Spirit. That's where I work 4 days a week. So.
And are you accepting clients?
Yes.
Okay, or patients, I should say. I will link everything for Molly down below. Okay. Like I said, highly recommend seeing her. She's the best.
Love you so much.
Thank you so much for doing
this. This was so fun.
Yeah, I'm so glad. All right, guys. I hope you have a great rest of your day, and I will see you next Friday.
Okay. That was fun.